maybe you've been there, sitting on the toilet and dreading the moment you have to stand up because you know your knees are going to hurt. Or getting out of the car and feeling that sharp twinge that makes you pause and brace yourself. Or lowering yourself into a chair and wondering if you'll be able to get back up without wincing. These everyday movements that most people never think twice about have become sources of pain and worry, and maybe even a little embarrassment when you need to ask for help. But here's what I want you to know right now. The problem isn't that your knees are broken beyond repair. The problem is that the way most people sit and stand puts unnecessary stress on knee joints that are already working hard. In the next few minutes, I'm going to show you knee-safe squat mechanics, the kind that actually work in real life for toilets, cars, and chairs, that can make these transfers comfortable, confident, and pain-free. Let me give you your first win right now, something you can try the next time you sit down or stand up. When you're about to sit or stand, widen your feet just a bit more than you normally would, maybe shoulder width apart or even slightly wider. Feel that? That simple change distributes your weight differently and takes pressure off your kneecaps. Many people notice less knee pain immediately just from that one adjustment. That's your proof. Small changes make big differences. Let's talk about why traditional squats hurt your knees, especially as we age. Traditional squats, the kind you see in gyms where people drop down low with knees traveling way forward over toes, put tremendous pressure on the knee joint itself. Your kneecap has to track through a long range of motion, and all your body weight is pressing down through that joint. For younger people with healthy cartilage and strong surrounding muscles, that might be manageable. But after 60, your cartilage has naturally thinned a bit. Your knee joint may have some wear and tear. Your surrounding muscles may not be as strong as they once were. Asking those knees to handle traditional deep squats is asking for pain. The good news is that you don't need traditional squats for real life. You need modified squat mechanics, movements that keep your knees safer while still allowing you to sit, stand, and transfer confidently. The key to knee-safe transfers is something called a hip hinge. Instead of bending primarily at your knees and letting them travel forward, you hinge at your hips and push your bottom back slightly. This shifts the work from your knees to your hips and glutes, which are much stronger and better designed for this kind of movement. Think of it like this. If you were going to sit on a stool that's behind you, you'd naturally push your hips back to find it. That's a hip hinge. When you hinge at the hips, your knees still bend. They have to. But they don't bend as much, and they don't travel as far forward over your toes. That reduction in forward knee travel is what protects your knees from excessive strain. Let's start with foot placement because this is foundational for everything else. When you're about to sit or stand, your feet should be about shoulder width apart or slightly wider. Your toes can point straight ahead or angle out just a bit, whatever feels natural for your hips. This wider stance gives you a more stable base and allows your hips to hinge properly. If your feet are too close together, your knees have to do more work. If your feet are too far apart, you lose stability. Shoulder width is the sweet spot for most people. Also, make sure your weight is evenly distributed across your whole foot, not just your toes, not just your heels, but the whole foot making contact with the ground. This keeps you balanced and prevents your knees from having to compensate for poor weight distribution. Now let's talk about controlled lowering, because how you lower yourself into a seat matters just as much as how you stand up. When you're about to sit down, whether it's a toilet, a car seat, or a chair, don't just drop. Dropping puts a sudden load on your knees and can cause pain. Instead, lower yourself slowly and with control. As you begin to lower, think about pushing your hips back first, like you're reaching for a seat that's slightly behind you. Your knees will bend, but they're following the movement rather than leading it. Keep your chest relatively upright, not perfectly straight like a soldier, but not hunched forward either. Your arms can reach forward slightly for balance, or you can place your hands on your thighs to help guide the movement. Lower yourself until you feel the seat beneath you, then sit fully. That controlled descent protects your knees because the muscles in your hips and thighs are doing the work, not your knee joints themselves. Rising from a seated position is where most people feel the most knee pain, so let's break this down carefully. Before you stand, scoot forward to the edge of the seat if possible. This brings your center of gravity closer to where it needs to be when you stand. If you're sitting far back in a deep seat, you'll have to lean way forward to stand, which increases knee strain. Once you're near the edge, place your feet flat on the floor, about shoulder width apart. Now comes the hip hinge again. Lean your torso forward slightly, bringing your chest toward your knees just a bit. This shifts your weight forward, so when you push up, your hips and glutes can do the work. As you begin to rise, think about pressing through your heels and the middle of your feet, not just your toes. Push your hips forward as you stand, almost like you're trying to stand tall and proud. Your knees will straighten, but they're straightening because your hips are driving the movement. If you need extra help, you can use your hands on your thighs to give yourself a little push, or you can use arm rests if they're available. There's absolutely no shame in using your arms. That's what they're there for. The goal is to stand with less knee pain, not to prove you can do it without help. Breathing during these transfers is important and often overlooked. As you're lowering yourself to sit, breathe in. As you're rising to stand, breathe out. This breathing pattern helps stabilize your core and prevents you from holding your breath, which can spike your blood pressure and create unnecessary tension. It also gives your movement a natural rhythm. Breathe in as you sit. Breathe out as you stand. Simple, effective, and it keeps everything working smoothly. Now let's get specific about toilet transfers because this is one of the most common sources of knee pain and frustration. Toilets are often lower than regular chairs, which means your knees have to bend more, which means more potential for pain. When you're about to sit on the toilet, position yourself so the toilet is behind you. Your feet should be shoulder width apart, toes pointing slightly out if that feels natural. Place your hands on your thighs or reach forward slightly for balance. Begin to hinge at your hips, pushing your bottom back toward the toilet. Lower yourself slowly and with control. If you feel like you're going to lose balance, you can place one hand on a nearby wall or grab bar for support. As you lower, keep lowering until you feel the toilet seat beneath you, then sit fully. Don't try to hover. That puts tremendous strain on your knees and doesn't serve you well. When it's time to stand, scoot forward slightly if you can. Lean your torso forward a bit to shift your weight. Place your hands on your thighs or on grab bars if they're installed. Breathe out as you push through your feet and rise. If your bathroom has grab bars near the toilet, use them without hesitation. They're there for exactly this purpose. If you don't have grab bars and you find toilet transfers especially difficult, talk to a family member or your doctor about getting them installed. They're inexpensive and can make a world of difference. Car seat transfers are a different challenge because car seats are often low and set back, and you're dealing with a confined space. When you're getting into a car, the key is to sit first, then swing your legs in. Don't try to step in and lower yourself at the same time. That puts awkward stress on your knees. Here's the technique. Stand next to the open car door, facing away from the seat. Reach back with one hand to feel where the seat is. Lower yourself onto the seat using the same hip hinge technique, pushing your hips back, keeping your chest relatively upright, lowering with control. Once you're seated, swing your legs into the car one at a time or both together, whichever feels easier. When you're getting out of the car, reverse the process. Swing your legs out of the car first so both feet are on the ground. Scoot forward to the edge of the seat if you can. Place both feet flat on the ground, shoulder width apart. Lean your torso forward slightly and push through your feet to stand. You can use the car door frame or the top of the door for support if needed. Many people find it helpful to place one hand on the door frame and one hand on the seat as they push themselves up. That's perfectly fine and actually quite smart. It distributes the effort and reduces knee strain. Chair transfers are usually easier than toilets or cars because chairs are often higher and have armrests. When you're sitting in a chair with armrests, Use them. As you lower yourself, place your hands on the armrests and use them to help control your descent. As you rise, press down on the armrests to help lift yourself. This takes significant load off your knees and makes the movement much easier. If the chair doesn't have armrests, use your thighs or place your hands on a nearby table or counter for support. The principle is always the same: hip hinge, controlled movement, and using your arms to assist when needed. One important point about seat heights: different seats require different strategies. High seats, like bar stools or high chairs, are usually easier on your knees because you don't have to bend as much. Low seats, like toilets, low couches, or car seats, are harder because your knees have to bend more. If you have a choice, choose higher seats when possible. At home, you can add cushions to low chairs to raise the seat height. You can buy toilet seat risers that add a few inches of height to your toilet, making transfers significantly easier. These are inexpensive and available at most pharmacies or online. For car seats, some people find it helpful to place a firm cushion on the seat to raise the height slightly. Small adjustments like these can make a huge difference in knee comfort. Now let's talk about strengthening exercises that support these transfers, because while technique is crucial, having stronger muscles makes everything easier. The muscles that matter most for sit-to-stand movements are your glutes, your quadriceps, and your core. You don't need to do heavy squats or intense workouts. Simple exercises done consistently will build the strength you need. One effective exercise is the sit-to-stand practice itself. Find a sturdy chair and practice sitting and standing 10 times in a row using good technique: hip hinge, controlled movement, breathing. Do this once a day, and within a couple of weeks, you'll notice standing feels easier. Another helpful exercise is wall squats or mini squats. Stand with your back against a wall, feet about shoulder width apart, and a foot or so away from the wall. Slide down the wall just a few inches, not all the way to a deep squat, just a small bend in your knees. Hold for a few seconds, then slide back up. Do this 10 times. This builds leg strength without putting excessive stress on your knees. You can also do seated leg lifts. Sit in a chair and straighten one leg out in front of you, lifting your foot off the ground. Hold for a few seconds, then lower. Repeat 10 times on each leg. This strengthens your quadriceps, which support your knees. These exercises don't take long, and they make real transfers, toilets, cars, chairs, significantly easier over time. Let's address common mistakes that increase knee pain during transfers. One big mistake is letting your knees cave inward as you sit or stand. Your knees should track in the same direction as your toes. If your toes point forward, your knees should move forward, not inward toward each other. If your knees collapse inward, that puts stress on the knee joint itself and can cause pain. To fix this, focus on pushing your knees slightly outward as you move. Another mistake is rising up onto your toes as you stand. When you rise onto your toes, you lose the support of your whole foot and your knees have to work harder to stabilize you. Keep your whole foot flat on the ground throughout the movement. A third mistake is rushing. Fast movements don't give your muscles time to control the motion, so your joints take the impact. Slow, controlled movements are always safer and more effective. Finally, many people forget to use their arms. Your arms are tools. Use them. Pressing down on armrests, thighs, or grab bars reduces the load on your knees and makes transfers easier and less painful. What should pain-free transfers feel like? They should feel manageable and controlled. You might feel effort, your muscles working, but you shouldn't feel sharp or intense knee pain. If you feel sharp pain, stop immediately and reassess your technique. Maybe your feet need to be wider. Maybe you need to hinge more at the hips. Maybe you need more arm support. Pain is your body's way of saying something isn't right, and it's important to listen. Effort is different from pain. Effort feels like muscles working hard, which is good. Pain feels like something is wrong, which means you need to modify. Let's talk about a daily practice plan because consistency is where real improvement happens. Every day, you have multiple opportunities to practice knee safe transfers. Every time you use the toilet, get in and out of your car, sit in a chair, start paying attention to your technique during these moments. Before each transfer, take a breath and remind yourself feet shoulder width apart, hip hinge, controlled movement, use my arms if needed, breathe. After a few days of conscious practice, these techniques will start to feel automatic. Within a week, many people notice transfers feel easier and less painful. Within 2 weeks, the new technique feels natural. Within a month, you might not even remember what the old, painful way felt like. That's how habits form, through consistent, mindful repetition. If you have significant knee pain or mobility limitations, don't hesitate to use assistive devices. Grab bars in the bathroom, a cane for extra stability, a raised toilet seat. These aren't signs of weakness. They're tools that allow you to move safely and independently. Many people resist using these tools because they feel like it means they're giving up or admitting defeat. But actually, using the right tools is smart and empowering. It allows you to keep doing things on your own instead of needing to ask for help. That's independence, not dependence. One more thing about seat positioning. If you have a choice, position yourself so you're facing open space rather than a wall when you sit and stand. This gives you room to lean forward slightly during the hip hinge without feeling cramped. In tight spaces like small bathrooms, you might need to adjust your angle to give yourself the clearance you need. For caregivers listening, if you're helping someone with transfers, the best way to help is to let them do as much as possible on their own while you provide support. Stand close by for safety, offer a hand or arm for balance if needed, but don't lift or pull them up. Lifting someone puts strain on your back and doesn't help them maintain their own strength and capability. Instead, encourage them to use proper technique and assist only as much as truly necessary. Over time, as you practice these knee-safe techniques and build supporting strength, you'll notice that transfers become less of a source of worry and more just a normal part of your day. You'll stop bracing yourself before you sit or stand. You'll stop feeling that little jolt of anxiety when you know you need to get up. You'll move through your day with more confidence and less pain. That confidence is what this is really about, not just reducing pain, but reclaiming the ease and independence that knee pain has stolen from you. So tomorrow, when you wake up and head to the bathroom, remember, feet shoulder width, hip hinge, controlled movement. Use your arms if needed, breathe. Try it once with intention. Notice how it feels. I think you'll be surprised at how much better it can feel with just those few adjustments. Your knees aren't broken. They're just asking for a better strategy. And now you have one.